Good evening, everybody. It's really great to be here with all of you. It really is quite an honor. And I say that, and I really mean it, because I think back, seeing you all talk about, this movement that you're moving forward in Vermont, in Washington, and think back how I first got involved, and when I first got involved in the Workers' Center was in 1999. And I had been just getting involved in the Workers' Center, and something happened over here that was really inspiring and really inspired a lot of us. The Battle of Seattle, I know there's folks here tonight that were down in the streets shutting down the World Trade Organization meetings. And that kind of movement of seeing forces come together, movements come together, labor movement and across different issues, really affected us, really raised our expectations of what kind of movement is possible and what kind of movement will be necessary to really fulfill the mission of our organization. In Vermont, the Vermont Workers' Center got started in about 1998 officially. And we did a lot of really great work fighting for workers' rights and livable wages and helping nurses and nursing home workers and others organize unions, doing our part, fighting free trade agreements and so on. But we really felt that we were just scratching the surface of what was needed to really fulfill our mission, to really have workers' rights and have the ability for people to live and work in dignity. And so we did a bunch of long-term planning, and it's really nice to be here on your 10th anniversary of your annual meeting, because at ours in 2008, we launched our Healthcare is a Human Right campaign. It was a big deal for us. We transformed as an organization. We became like kind of a workers' rights coalition, mobilization organization, to a grassroots base building organization, getting our communities organized to try to have the power to change what was politically possible. We knew that it was going to take a long time to do it. We had politicians that told people that they supported this, but when it came time to actually do it, there wasn't the political will, as was said here, and it sounded very familiar. And so, we said that we were just going to get out and get our communities organized, and we were also going to bring forth the stories of what the healthcare system right now, how people are experiencing it, and how the unjust realities of people not getting care when they need it, falling into medical debt, and all the various ways that right now our healthcare system is leaving people out and creating a lot of suffering, amounted to a human rights crisis. And that we would indict that system and then be able to use human rights in that framework to be able to have a system that was more in line with the values of our communities, that would be universal and it would be financed publicly and financed in an equitable manner. And it would also be accountable to communities and transparent. People could participate in the major decisions that were about universal health care. So it was a big goal that we set out to do. And we went around and we surveyed thousands of Vermonters. We ended up having these human rights hearings across the state to bring forth these stories. And then we ended up building for a huge rally at our state capitol, a Healthcare is a Human Right rally on May 1st, 2009. So we weren't really dealing with elected officials at that stage. We consciously said, we just want to get our communities organized and begin showing that a lot of people could act together and start raising expectations about what was possible. We had the biggest rally in the history of the state on a weekday at our state capitol with 1,200 people. Vermont's a little state that came out and on a weekday came and just had a massive rally. And then we started saying, okay, now we can start thinking about bringing this movement inside the State House and holding people accountable. And in the course of a few years, that what was politically possible began to change. One big thing happened that made it happen a lot quicker was our governor decided not to run. We had a Republican governor at the time. And so in that 2010 legislative session, when we had all this energy going forward, all of a sudden a bunch of ambitious legislators that were thinking about running in the Democratic primary for governor started getting very serious about trying to move forward for universal health care. We passed a law that was figuring out how Vermont can do this. During this time, while politicians were starting to change what they were saying about what was possible, on a federal level, from 2008 into 2010, we were watching the Affordable Care Act be carried out. And there was people in Vermont and beyond that were saying this was going to be the best thing that this country can do around universal health care or around health care reform. And we from the very start said this is not going to solve the health care crisis. We're going to still have people with insurance products that don't adequately cover them and their families, and Vermont had a responsibility to keep forward. I will sort of fast forward through some of this stage so we can get to talking about where we're at right now. But essentially, in a very tight election, one of our very ambitious senators won in a primary by 500 votes. He was championing universal health care amongst 5 top candidates. 2 of the other candidates were also very strongly championing universal health care. But he won. He was unfortunately the guy that we probably trusted the least. He was very ambitious, one of the richest guys in the state. But he was using this, saw the political expedience of doing this. And then he squeaked out a victory in the general election by 2,000 votes over our lieutenant governor. And went in to 2011 with saying, I'm the guy that can get things done, healthcare is a right, and Vermont can lead the way. And that year we ended up passing Act 48, a law that would bring Vermont to having the first universal healthcare system in the country. One important piece as that kind of went through with this political momentum, we had a supermajority, Democratic-controlled legislature at the time, was that the Democrats actually added an amendment in the Senate right before it got voted out that would have excluded undocumented workers. And in Vermont, that means thousands of dairy farm workers. And the governor's office and the legislative leadership, they all said this was impossible to get out. This was an amendment that they, some reason, had to have in there. And we said absolutely not. We had massive rallies. The May 1st rally that year was the biggest one ever. And 2 days later, on May 3rd, they actually removed the amendment, which was a tremendous victory kind of on top of the victory that was happening. That was in a very interesting year. Occupy Wall Street ended up happening that fall. We got smashed with a Hurricane Irene, which was, devastated a lot of poorest areas of the state. Mobile home parks that were built in the valleys and floodplains. And so, our movement at that stage, we had to wait to 2017 because of the Affordable Care Act to actually implement a universal health care system. But many of people in the organization across the state were really seeing that we can't have a just healthcare system in an unjust society. And the effects of poverty are part of our right to health. As Margaret will probably talk about, the social determinants of health are a huge factor whether people are going to get healthy or not. So you could have a universal healthcare system, but if you have poverty that is, people are homeless and not getting the things that they need, then people still don't have the right to be healthy. So we started a broad movement called Put People First, working with a bunch of partner organizations, and we formed a Human Rights Council and kept building a movement. We started pushing for this idea of a people's budget, which would change the way that the state goes about the whole budgeting process, which is kind of just taking whatever taxes they had the year before, seeing if they have enough money. They don't, so they cut incredibly important programs that our communities need. We said, you have to go out and talk to communities. What do community needs assessments and look about what are the priorities to make sure that people have the right to live in a healthy and dignified lives. And we were able to pass some statute with that as the clear goal of our state budget. And also, we were thinking about how do we finance a healthcare system in a way that's equitable. And it's such a big endeavor. We're really talking about, how do we have just taxation policies? How do we have the needs of our communities met? And so, we started a much bigger movement that we realized in Vermont, wasn't just about passing one law, about passing 2 laws. It was about really having a people's movement that was capable of shifting things so that we could have a real democracy, that people were accountable, and they weren't just giving us the lines that they thought we wanted to hear so they could get elected, but they were actually committed to doing it because we had the ability to hold them accountable. So this gets us to our situation now. We have continued forward. We've had some big victories with some of our partner organizations. But as this movement building work has grown, our governor has really shown his true stripes in many ways. he basically dangled this idea that he was going to do universal health care as a carrot to progressives, while he acted like a Republican in almost every other way. He killed the paid sick day bill. He cut programs, said he will not raise taxes on the wealthy, and we have to cut our welfare program, our Reach Up program for mothers, and really angered a lot of people. He did a bunch of other things, including his administration bungled the whole healthcare exchange. The website was a fiasco, security breaches, the media jumped all over it. And like I said, people didn't really trust this guy all along. He's a smart politician, but he's now become one of the more unpopular people. In this last election, he was running against literally no one, this guy that no one knew. He outspent him 8-1, and he was an incumbent, and he only won by 2,000 votes. It was the lowest voter turnout in the history of the state. And then he came out and said that he is not recommending that we move forward with universal health care. He said, the state can't afford it, even though that his job was not to make that determination. His job by the law was to bring forth a proposal about how we could move in this direction, and the legislature makes that determination. But he instead did that. He brought forth a non-recommendation. His administration actually had some good people working in there. We dug into this 80-page report, and they had actual proposals where 95% of Vermonters would benefit under this shift to public financing. And yet he said it was not a political decision but an economic decision. So we immediately had massive rallies. This was in December. We had a big rally the next day. At his inauguration on January 8th, we brought a rally inside of the State House and ended up occupying the inauguration, and 29 people got arrested. And ended up having just their charges dropped a couple of weeks ago. This was, something that we needed to make sure that the Democratic people that have been in power now in Vermont, having super majorities in both legislatures and the governor's office, knew that people were not going to stand for this, and that we were going to continue to make a political mandate to move forward. So that's where we're at now. The legislature let him delay coming out with this proposal for 2 years, and now they're letting him not move forward with his obligations under the 2011 law. We are continuing to build a movement right now that is joining with our state employees who are facing massive layoffs and cuts to important services. Next April 11th, a few Saturdays from now, we will be having another massive rally at the State House, and then building up to a mass action in March on May 1st down in Vermont. If you lived closer, I would really encourage you to come. Our spring will just be coming then. But we have our work cut out for us. I just wanted to say also that we really see, this is really inspiring to me to see you all, the work that you're doing here. I mean, it's just, like I said, back in 1999, that work had impact across this country, across the world, and what you're continuing to do, Fight for 15 and strike poverty, and all of that work is, we really do see it as one movement. Our victory in Vermont is only as good as it creating a movement for it happening in other states. I know there's been a lot of talk about, should we try to fight for this on a state level, or should we try to fight for it on a national level? And for us, there's no doubt that it makes a lot more sense on a national level. But we must fight where we can win to create momentum. And so we're going to do everything we can to be a catalyst by trying to win it in our little state. And we're just really super inspired to see all the work that you all are doing here. We'll need your support. It's going to be tough. We saw, in the last election, one of the other factors was a bunch of Koch brother money came in to scare a bunch of seniors about, what this would do to them, and sending mailings and phone calls and stuff, and it had an impact on a number of tight legislative races. And we're starting to see, Vermont had not had that kind of campaigns before this past election, and we're starting to see it now. There's definitely people that want to stop us that are outside our borders. And so we really do believe that our movement has to have, solidarity across all the states, across the borders. I'm just really excited to continue to hear about all the work that you all do. And I think, as Jim said, we think there has to be a lot of dedication to a universal healthcare movement. You can't just organize around it takes a lot of focus. But it also can't be in isolation, because it is not an issue that stands alone. So it's just really excited to see all the tables out here with the Transit Union and Fight for 15 and all the great organizations fighting for things. And that's exactly what we're trying to foster up in Vermont. And I just am really excited to be here. I can't wait to come back. It can't be anything but a lot of jealousy. It snowed today in Vermont, so it was really nice to be here. Your spring is ridiculously beautiful. And I'm just super excited to come back out here and celebrate more of our victories. Thanks very much.
Thank you very much, James. Tonight, it is my pleasure to introduce Dr. John Guyman, who will make the presentation of the award given in his name to our 2015 recipient. Dr. Guyman is Professor Emeritus of Family Medicine at the UW School of Medicine. He was the department chair from 1976 to 1990 after he was recruited from California, where he had set up a network of family practice residencies. His love of rural medical practice is evident in his first practice after his training in Mount Shasta, California, and his last years of practice in Friday Harbor, Washington, following his retirement from the UW. Dr. Guyman has written a shelf full of books about the nature of family practice, about the joys of flying small airplanes, about the emotionally difficult task of caring for a loved one with progressive dementia, and, most of all from our point of view, about the need for major reform of the American healthcare non-system. His most recent book, How Obamacare is Unsustainable, is truly a must-read, superb analysis of the Affordable Care Act at 5 years of age. And I mean this, I've read it. I got it while the ink was still wet on the book, and I have read it. It's really very well done. It's available outside for a donation of $15, and we may have some signing. Maybe there will be the opportunity to grab Dr. Guyman and get him to autograph your book. Dr. Guyman is a longtime member of PNHP and was our national president from 2005 to 2007, the period in which our chapter was founded. That's why his name is on our annual Health Justice Advocate Award. Just flew in from Friday Harbor? Dr. Guyman.
Well, thank you, Sherry, for that kind introduction. Can you hear?
Stand a little closer to that.
Okay.
And you'll be all right. Yeah.
Can you hear from here?
Yep.
Okay. Well, thank you for that kind introduction, and I'm honored to be here in several ways. Number one, Quentin Young was one of my heroes in medicine and a classic leader in healthcare justice, and the author of another very good book that's out here, Everybody In and Nobody Out. He was an internist in practice in Chicago for many years. He was head of medicine at Cook County Hospital for a lot of years. Early PNHP leader all the way through. Since his book, I understand he's retired to Northern California. He's in Berkeley with his physician daughter and doing fine, I hear. So I'm honored to be named in this award, and honored to be part of this group. It's a long slog, as we just heard from James in Vermont, and you've been there. You fought the fight, and I took special note of your idea. You can't have justice in an unjust society, and that reverberates with a meeting of 20 years ago where we were meeting in family medicine in Denver in our national experience in primary care. How can you practice the medicine we've been trained to do and want to do in a crummy system? So anyhow, this is always an inspiring group, and our task couldn't be, the stakes get higher every day. The last 3 days I've been reading about what's happening in the House and what's going to the Senate on Medicare, quote, reform, which will be a total disaster if it goes through. And so the powers against social justice and health care are getting stronger all the time, and the politics are very tough. So anyhow, it's my honor now to announce the winner of this year's Health and Social Justice Award to James Haslam, who just gave this great talk. And there's no question in my mind that you're the person. Great job.